Okay, so today we have a 26-year-old male patient, and we have done 5 months post-surgery, post-orthognathic surgery follow-up, and he came to us through one of our colleague, Dr. Megha Shah, and he had a preliminary complaint of underbite, difficulty in chewing food, as well as some facial aesthetic issue. His look was he was not very happy with his look. He had a long face along with protruding lower jaw and backwardly placed upper jaw, and he was already undergoing pre-surgical orthodontics with a colleague of Dr. Megha Shah, and we did thorough examination, and we advised a few investigations like 3D CT scan, intraoral scan, and we took the photographs for the study. After thorough examination, we decided to go for bijaw surgery. In his case, we used this data for the virtual surgical planning, and then we uploaded all the data on the virtual surgical planning, and we planned for the maxillary advancement and mandibular setback, and genioplasty was not necessary in his case because he had a good chin prominence, and after mandibular setback also his chin prominence was coming out as a good prominence as per the male profile. So we only plan for Lefort 1 maxillary advancement and mandibular setback surgery, and we did surgery 5 months back, and we took minimally invasive surgery approach. So in minimally invasive surgery, we take a very small incision for the jaw surgery, and we use a piezoelectric saw for the surgery. So advantage of minimally invasive surgery is very less swelling, faster recovery, much more comfort pain wise as well, and patient can resume his work very quickly. So we did his surgery using a minimally invasive approach, and it was like a teamwork with Dr. Megha Shah, and he was in the hospital for 2 days, and after 2 days we give him discharge, and today we are seeing his 5 months post-op follow-up, and he has a very good stable bite, and his facial proportion and profile is also very nice. So overall, slowly he is right now undergoing post-surgical finishing orthodontic, and it may take another 4 to 5 months for finishing this case. Thank you.